Are follow-up appointments necessary after a bladder biopsy? Getting a bladder biopsy can feel like a big step in understanding your bladder health. But what happens afterward? Do you really need to see your doctor again? The answer is yes. Follow-up appointments are very important after a bladder biopsy. They help ensure your recovery is on track and that your health is properly monitored. When a bladder biopsy is done, a small tissue sample is taken from the lining of your bladder, usually during a procedure called cystoscopy. This tissue is then examined by a pathologist to check for signs of cancer or other issues. After the biopsy, your healthcare provider will want to review these results with you. This is crucial because it guides what happens next. If the results show cancer, further testing or treatments might be needed. If no cancer is found, your doctor will still want to keep an eye on your bladder health. Follow-up visits are also essential to watch for any complications. Some people might notice blood in their urine, feel discomfort, or experience urinary urgency or frequency after the procedure. These symptoms are common but need to be checked to make sure they are not signs of infection, bleeding, or other issues like urinary retention or, very rarely, bladder perforation. Your doctor can assess your healing process and provide medications or advice to ease any symptoms. Another key reason for follow-up is to plan additional testing if needed. If cancer is detected, your healthcare team will likely schedule more cystoscopies, imaging tests, or lab work to see if the cancer has spread or recurred. Bladder cancer has a tendency to come back, especially within the first 2 years after treatment. Regular surveillance, often every 3 to 6 months, helps catch any new or returning tumors early, which improves treatment success. Follow-up appointments also support your recovery by managing symptoms like pain or urgency. Your doctor might recommend medications or lifestyle changes to promote healing and comfort. Typically, a follow-up visit occurs within 1 to 2 weeks after the biopsy to check on healing and discuss results. For those diagnosed with bladder cancer, the schedule becomes more frequent, with cystoscopies every 3 months for the first year or 2, then less often if no issues arise. In summary, follow-up appointments after a bladder biopsy are a vital part of your care. They help confirm your diagnosis, catch complications early, guide further treatment, and monitor for cancer recurrence. Always remember to discuss your specific situation with your healthcare provider, as individual needs can vary. Staying engaged with your medical team ensures the best possible outcome for your bladder health.